it's going to be important that the federal government, as I said, steps up and increases its share of the costs of healthcare with the Canada Health transfers. We are going to do that, and I look forward to conversations over the coming months about how we can increase it. Of course, our focus remains right now getting through this pandemic, and as I said multiple times to the premiers, we will be there to support them with extra healthcare costs linked to this pandemic, whatever it takes, for as long as this pandemic lasts.
Reaction from the Prime Minister after today's First Minister's meeting. The provinces were looking for an increase in health transfers. Ottawa says its focus remains squarely on the pandemic. So what to make of these seemingly competing priorities? It's Thursday. I'm here with At Issue, Chantal Hébert, Andrew Coyne, and Althea Raj. All right, Andrew, I'll start with you this week. The Prime Minister, he does seem to acknowledge there's a need to increase the health transfers, but didn't seem to be committing to any kind of timeline. What did you make of it?
Yeah, that he didn't want to mix the two together. He's prepared to give them lots of money now for the pandemic. At some point in the future, he may give them more money for the longer run problem of rising healthcare costs far beyond the pandemic. This has to do with the aging of the population. It's been going on for years. It will go on for decades. So the provinces have a long run problem. But because they have the problem, because they're the demandeurs, the feds have the money. They're in the driver's seat. They can, they need the provinces for some things, but the provinces need them more. So he will act on his own timetable. Remember also, the money isn't for healthcare. We all say it that it's just money. There's no dollar tag. There's no labels attached to it that say you can only spend it on healthcare. The provinces need more money. The feds have money. At some point, they're going to negotiate some process for transferring it. My hope, probably to be dashed, is that in the long run, what we'll do is transfer tax revenues, tax points, rather than this endless game of cash transfers, which just blurs accountability and leads to endless finger pointing. But I suspect the pleasures of attaching conditions to those transfers will be too much for the feds, and they'll continue to do that.
Yeah, well, as I was going to say, yes, you're right. It's just money, but it does sound like it's money that the federal government wants to see, according to the Prime Minister, more accountability for, hinting that there need to be conditions around wherever that money goes, Chantal.
And that's a we'll see issue in the sense that I think what most premiers came away with was they're not going to be getting that increase in the next federal budget. And a lot of them, starting with Premier Legault, assume that there will be a federal election before the next budget in 2022. Now, if you were Justin Trudeau, would you not prefer to campaign on having more money for long-term care and the federal government looking at national guidelines to ensure that the disaster that unfolded last spring does not again? Or would you want to campaign on saying, I just gave an increase of 1% or 2% in the rate of increase of a health transfer? Your eyes have glazed over. That's what voters will have done. So there is a political game here. Premier Legault says he will now be, on behalf of his colleagues, trying to get the opposition parties to put pressure on Justin Trudeau. That may or may not happen. He may set in place the conditions for the government to go down on the next budget. Whether that will result in a government that is more amenable, question mark.
But there were other premiers. I realize that the Premier of Quebec is the head of the council right now of Federation, but there were other premiers who were not quite as dismissive of the Prime Minister. Stephen McNeil, I mean, perhaps not surprisingly, he's of the same ilk of the Prime Minister, but John Horgan as well did not seem quite as defeated as Premier Legault or Premier Ford, for instance, Althea.
Or Scott Moe, who nobody would be accusing is a Liberal. I actually thought there was a lot more came out of this meeting than I had expected. I think the Liberals the federal Liberals here had really downplayed expectation. The fact that the Prime Minister came out and acknowledged that Ottawa needs to do more is substantial, and it's something that Stephen McNeil and Scott Moe both latched on, and both really seemed to believe, at least they were communicating that they believe the Prime Minister and that they believe that he wants to be a long-term partner. He believes the federal government should take a bigger slice of that pie to be paid for by federal coffers. And Premier Legault's rehash of the meeting today did not seem to reflect the press conferences that other premiers had in the day, and that he led off saying he was deeply disappointed, that the premiers were deeply disappointed, that the Prime Minister had been dismissive of the remarks. The Prime Minister in his remarks actually said that if the premiers had been willing to make a deal on long-term care and pharmacare, he seemed to be willing to have made a deal. But I completely agree with Chantal. I think election politics is playing into this. I think the federal Liberals don't want to be pegged to a timeline that might interfere with a promise that would be in a Liberal platform. And Mr. Legault also is playing politics and trying to convince, in this case, the federal Tories to promise an increase in federal transfers in their next election platform.
The other part of that conversation today, what we're led to understand, the vast majority of the morning was spent on vaccines as all the provinces get ready to roll out vaccines next week. I want to do one go round on how the federal government managed these announcements this week. Here's the Prime Minister reacting to that news yesterday.
This is a big deal, Mr. Speaker. It is a good news day for Canadians. We will see 30,000 vaccines begin to arrive next week, with many more on the horizon. But we are not through this yet. We've got a tough winter to get through.
It was interesting. Obviously, I mean, it's a win for the country. It's probably a win for the government too, Andrew. But it was interesting to see the politics of how this unfolded this week and the way the federal government positioned themselves around it.
Yeah, well, it was the Prime Minister himself who was saying not too long ago that we weren't going to see vaccines till sometime between January and March. That remains mostly the truth. We're going to get an early shipment of 250,000, I think it is, vaccines that came out of somewhere. There was a lot of suspicion afoot. This was essentially got up on the fly so they could have something to say to the opposition. Whether that's true or not, we shall see. But the proof is going to be what happens in the months to come. Do the vaccines that we've ordered, do they show up? Are they distributed in a timely fashion? Do they get them into people's arms in some large proportion of the population? And right now, the schedule is, the last I heard was, it's still the same, as we're going to have enough for maybe 3 million Canadians by the end of March. We'll see how that stacks up against other countries. Right,
but Chantal, the whole idea that Canada has no plan or Canada's at the back of the line, I mean, that doesn't seem to be factual at any rate right now.
Well, it was great political management. There was a horse before the cart moment. You have the Prime Minister laying out how many vaccines are going to be distributed across the country before the end of this year, before Health Canada actually approves a vaccine. You would have thought normally that it would be the other way around. But politically, if you want to gauge the success of an operation, you go to question period and you look at how many questions the opposition still wanted to ask after that announcement that there would be a rollout in December. The answer to the question is no questions from any party except the Conservatives, and very few of those.
Yeah. I mean, the questions from the Conservatives swapped from where is the plan as all the first questions to, hey, what about the wage subsidy? Althea, how do you think the government managed that?
It's another example, just like the previous example we've just been talking about, of downplay expectations and over-deliver. I mean, you had the Conservatives in the House of Commons over the past several weeks accusing the Liberals of being incompetent, of mismanaging the issue, of saying that Canadians were going to be vaccinated in 2030, if you were listening to Michelle Rempel. And then lo and behold, Health Canada approves the vaccine before the FDA. So it's in some ways, the Conservatives allow the Liberals to look a lot better than they otherwise would have.
I hope not suggesting the Prime Minister had anything to do with the date in which Health Canada approved this vaccine.
We're not, because we don't know.
I just hope that's not the case.
Yes, no, well, it doesn't. I mean, there's no evidence that happened, but the way things unfolded certainly went well for the government. And I wonder what it tells us, though, about the risks of criticizing a plan like this with so many unknowns. Chantal.
So, yes, here was the big risk, and it turned out to be a real risk. If you start criticizing and predicting the future on an operation like the vaccine deployment, you are taking a risk, in this case, that kind of backfired. The fact is that if the Liberals mess up the vaccine deployment, if that trickle in December does not turn into a river in January, February, March, judgment will be cast on them regardless of what the opposition has to say, and they will be judged harshly. So there is a point where it's worth just holding your breath and not predicting doomsday scenarios that allow the government to actually look good when it's not, you know, Superman didn't come out of a phone booth this week.
Yeah. Well,
it works in reverse, though, as well, which is if you take a victory lap before you've actually delivered, that can also come back to haunt you.
The mark of a leader is the ability to bring divergent points of view together to do the right thing. Instead, we saw attempts to stop this bill from moving to the Senate, all while people out there continue to suffer.
That was the Justice Minister reacting on Thursday after Bill C-7 that would expand access to medical assistance in dying passed in the House of Commons. It now heads to the Senate with just a week to go before a court-imposed deadline to address some of these changes. Chantal, Andrew, and Althea back for an extended round of At Issue. I'll start with you on this one, Althea. There is obviously a lot of pressure. I'm not sure the Senate can get it done. I suppose technically it's possible. I'm not sure if there's willingness, at least from some senators, to do that this quickly. At least one Conservative senator, Denise Batters, saying the only reason we're in this tight time frame is because the government prorogued for a period of time, had to reintroduce the legislation, and now we are with this. Now we are, in this tight spot as senators. What do you make of it?
It's not an argument that she's unique in proposing. The Conservatives have been saying that since the beginning, and they're not entirely wrong.
Yep.
It would, had prorogation not happened, there would have been extra days in the calendar, and it is quite something to send a bill that is literally about life and death to the Senate and give them 1 week to do it and say, well, you kind of have to pass it the way we gave it to you. Otherwise, the House has to come back and everybody needs to vote on this again. But to me, this is a very interesting bill for the Conservative Party because it really speaks to how Aaron O'Toole, the new Conservative leader, is trying to manage his caucus. A lot of MPs and senators would consider themselves pro-lifers. Our social conservatives are genuinely very deeply worried that the bill would make it too easy for disabled Canadians or Canadians who feel like they don't have access to palliative care to end their life sooner than they otherwise would because of financial pressures, perhaps by family members or by the state. And they have been trying to stall this bill as much as possible. And yet Mr. O'Toole is eyeing support in Quebec and knows that he should not blow the December 18th Supreme Court deadline, state Supreme Court deadline in the Quebec Supreme Court. And he's having a hard time managing this. And the pro-lifers do feel like they are somewhat emboldened. So it is a very interesting piece of legislation. And the Liberals have not been wanting to give Mr. O'Toole a win. And even some amendments that in another era you could see would have been approved have not. They have tried really hard not to give the Tories a win on this bill.
And we should point out that the reason the court challenge, as you said, comes from Quebec, and that's why there's a perception that it is there's more heavily invested in Quebec. I'm not sure that's accurate. I'm sure there's lots of people across the country that may or may not want to see this expanded. But all those things are interesting about the Conservative Party, but it's also interesting that the Liberals they could have gone back to the court and said, could we have a further extension? They could have, there are things that they could have done to allow themselves more time to deal with, as Althea says, such a critically important piece of legislation, Chantal.
Well, two things. One, Justin Trudeau did tell Canadians during the election campaign that he wouldn't be appealing the Quebec ruling and he would be rewriting the law to adjust it to the Quebec ruling. So this was on the election platform with support from other parties. Second thing, this deadline is the second extension that the court has given. And courts tend to look badly at granting extensions. So one suspects that if it ever came to that, and it could still come to that, the extension will not be until July 1st. Remember when the initial Supreme Court ruling that led to the actual law came in and the Liberals asked for an extension, they did not get from the Supreme Court the length of time that they had asked for.
Right. That's
so
right.
There are limits to extensions. This was interesting. I thought the Conservative handling of this was interesting because for 2 weeks, essentially, Conservative MPs have been talking to themselves. It's been clear for a long time that this bill would pass with support from 4 of the 5 parties in the House of Commons. And one of the reasons the Bloc Québécois and the NDP were not willing to help the Liberals cut off debate was that the Bloc in particular was very happy to have Aaron O'Toole and his MPs just go on and on and on and try to stall the bill. Expect it to come back whenever Mr. O'Toole in the next federal campaign goes to Quebec and says that he's not a social conservative. Expect the Bloc and the NDP to say, really? And the Liberals. But if you're going to let your social conservative wing have free rein with every issue, what do we care where you stand?
Right. Yeah, the Bloc, I noticed, was tweeting, I think it was yesterday, that the religious wing of the Conservative Party was holding this legislation hostage. So, yeah, you can see them easily laying the groundwork there. Andrew.
Well, I don't think it's the religious wing, whatever that is, in the Conservative Party. Virtually all of, I think only about a dozen or so Conservative MPs, 15 I think it was, voted with the government on the bill. Most Conservative MPs are against it. And increasing numbers in the polls of Canadians are uneasy about where this is going. When this whole issue arose, it was supposed to be about people who were near the end of life, mentally competent adults in extreme physical pain who were unable physically to end their own lives and needed help for it. Each of those restrictions and caveats and conditions and limitations upon it have been progressively stripped away in ways that are really hard to understand. The government could have appealed that Quebec Superior Court ruling, decided not to for whatever reason, but comes back with a bill that doesn't just strip away the restriction requiring people be, their death be reasonably foreseeable, but also for some reason takes out the 10-day waiting period. So there's a lot of legitimate questions that people are asking about this bill, and it defies belief that they will be forcing it through on such a tight timetable, even with the constraints that they're under in terms of the Quebec ruling, the court ruling. They could seek an extension. They could, in fact, go through the process of having for a short period of time a different legal regime in Quebec than the rest of the country. I would say that's a lesser evil than pushing through a bill that has potentially severe flaws in it and has a lot of people very uneasy on such a tight timetable. I don't see why it has to be pushed through. That the world doesn't end if they don't get it through by Christmas.
Okay, Chantal, and then we'll wrap it up unless Althea wants one more word. Yep.
I get that you get to ask the questions, but I would be curious as to how Andrew reconciles this with the notion that the Senate is now being handed a bill that has 4-party support from the elected House. And is he suggesting that despite that, the Senate should suddenly decide that it knows better?
No, I am not. I am not advocating the Senate overturn the will of the Commons.
I don't mind when you ask a question once in a while. That's fine with me. Okay, Althea, you get the last word, then I got to go.
2 things. I think to Andrew's point, there were good amendments that were brought forward by the Conservatives. And that's what I mean by the Liberals refused to give the Conservatives a win on simple issues. Like the Green Party had an amendment about collecting data about the types of, like the identifiers about who was requesting MAID so they could make a determination about, where the gaps in the system are. They're mostly like poorer people who are asking for medical assistance and dying. And the government refused that amendment. That being said, I think we can't divorce the fact that we have a new justice minister that when MAID was first introduced, voted against that bill and said he did not believe that it reflected the will of the Supreme Court. A lot of MPs in that Liberal caucus also felt that Jane Philpott and Jody Wilson-Raybould, who were working together on that bill, chose a more conservative approach, small c conservative approach in this case, that was more restrictive. And they believe that the Quebec Supreme Court has basically reflected the original will of the Supreme Court, and preventing people or allowing people who are really in huge suffering, that 10-day window, that it is unfair to them to allow them to continue to suffer when their will is clearly expressed.
Okay, good, tough conversation, but good one. Thank you very much. I appreciate it.